Hello, I'm Dr. Perino, one of the radiologists here at South Sound Radiology. Your doctor has requested that we perform a nerve root injection. The procedure will be performed by a radiologist with the assistance of a radiologic technologist. I would like to take the next few minutes to describe the procedure, its risks, potential benefits, and alternatives. But first, let me give you some background information on the procedure and why we are performing it on you. I hope that this video answers most of your questions. You will have time to ask questions either to the technologist or the radiologist before getting started. Nerve root blocks treat a specifically targeted nerve in an attempt to produce long-term relief, primarily in patients with back pain that radiates to the legs. The causes of back pain are not completely understood, but they are probably due to a combination of several processes that include direct pressure on nerves, congestion of the veins that drain them, and accumulation of noxious chemicals from herniated discs. Nerve root injections are usually ordered in patients after surgery who have recurrent back pain, in patients with disc herniations, in the diagnosis and treatment of low back pain, or to determine if a certain nerve root is the source of symptoms. How effective are nerve root injections? Steroids are widely used in nerve root blocks, epidural injections, and facet joint injections in an attempt to provide temporary relief from pain. When selective nerve root injections are performed for disc herniations, the goal is to provide pain relief for enough time to allow the extruded discs to shrink and break the pain cycle, so that you can get back on the road to recovery. But symptomatic improvement is variable and unpredictable. The injection does not correct the underlying abnormality. The response of an individual patient is extremely variable. Most studies report an average time of pain relief of 1 to 3 months, although others have described much longer relief in a high percentage of patients. How are the injections performed? Nerve root injections are performed while you are awake. The radiologist assistant will clean your back directly over the affected nerve. The radiologist will then use a local anesthetic to numb the skin. The doctor will use a form of real-time X-ray called fluoroscopy to guide the placement of the needle. Sometimes a CT scan may be required for image guidance when significant degenerative changes obscure the target. You may feel a sensation like an electric buzz traveling down your leg as the needle approaches the targeted nerve. Before injecting the medication around the nerve, he will inject the area with a small amount of X-ray dye to confirm that he has achieved optimal needle placement. Your radiologist will inject a solution containing a long-lasting anesthetic and a steroid. The anesthetic is called bupivacaine, also known as Sensorcaine. It is a rapid-onset, relatively long-lasting anesthetic. The steroid is called betamethasone. It is a potent synthetic steroid that reduces inflammation and promotes healing. After the injection, the skin site will be cleaned and a Band-Aid placed by the assistant. This process may then be repeated depending upon whether other sites are symptomatic. Although the actual injection only takes a few minutes, the overall procedure usually takes about 30 minutes. What will I experience during the procedure? You will probably feel a small stick from the anesthetic needle, followed by 2 to 3 seconds of slight burning. Then you will experience intermittent pressure and possibly mild pain sensations during needle positioning. You will probably feel an electric buzz down your leg as the needle approaches the target nerve. Finally, you may feel some pressure during the injection of medications. Immediately following the procedure, you may feel a reduction or complete relief of your back pain. This may last 1 to 4 hours. After the anesthetic component of the injection wears off, your back pain may return. The therapeutic effects of the steroid may be noticed 1 to 2 days after the procedure, and your symptoms will probably continue to improve for 3 to 7 days. The potential benefits may last from several days to weeks or months. You will be able to walk immediately after the procedure, although some patients may experience leg weakness and numbness or tingling for a few hours. Because your reaction times may be affected by the injection, driving is not recommended. You should have someone drive you home. Once home, you can treat any pain at the injection site with ice or pain medication as prescribed by your referring doctor. It is generally recommended that you take it easy for the first day. After the first day, you can usually return to your activities as your pain will allow. In most cases, you can return to work the day following the injection. You should not have an injection if you are prone to excessive bleeding or are taking anticoagulation medications such as Coumadin or heparin, if your back pain has been diagnosed as a result of an infection or cancer, if you have a known history of a major allergic reaction to anesthetic or steroid solutions, if you have a local infection at the intended injection site, if you are pregnant, if you have a significant active infectious process elsewhere in your body, if you have active bleeding ulcers, treatment-resistant diabetes mellitus, severe uncontrolled high blood pressure, or congestive heart failure. If any of these conditions exist, please notify the radiologic technologist. There are possible complications with just about any medical procedure. These are rare. They include pain at the injection site, bleeding, infection, worsening of your pain, inadvertent dural puncture, nerve injury, or allergic reaction to the medications. Be sure to let us know if you are allergic to X-ray dye. Side effects of steroid medications may include difficulty sleeping, nightmares and nervousness for 1 or 2 nights after the procedure, facial flushing, low-grade fevers for 1 to 3 days, heartburn, stomach pain or nausea, and/or headaches. What are the alternatives to steroid injections? Medical therapy, physical therapy, or surgery? I hope that this briefing has been informative. If you have any questions regarding your procedure, please feel free to ask the radiologic technologist or radiologist.